Hello and welcome viewers. We are at BW Healthcare World Oncology Summit 2023. I am Bhupendra Pantola. With me, I have Dr. Dipanjan Panda. So first of all, welcome.
Thank you.
If a patient has been diagnosed by cancer, what is the attitude that is required in order for him to transform from um, cancer victim to cancer survivor? What would you say over that?
So that's a very good question. The first of all I want to say is that anybody can be detected with cancer, and please do not be afraid. It is like any other disease, and I want to reiterate that it is like any other disease which can be treated, in our country, in your own city, and there are facilities both in government and private. So please do not be afraid and do not be shy. Please talk to your family members and go to the nearest hospital, be it government, be it private, wherever you feel comfortable. Detected early, cancer is curable, irrespective of what type of cancer it is. But if you sit on that out of fear, which we do see, then unfortunately it can spread, it can become advanced stage, and then cure becomes more difficult. So I think that attitude of treating cancer like any other disease is most important.
Uh, Thank you, sir. What would you say over the carcinogenic factors? Which factors or which causes lead to cancer, and what should people watch out for, especially with respect to lifestyle and eating habits?
As I said in the panel discussion, there are factors for cancer which are modifiable and which are unmodifiable. So the unmodifiable factors are your age, you cannot change that. Your gender, you cannot change that. Like breast cancer will happen obviously in a female more than male. Of course, it happens male. And testicular cancer is an exclusively male cancer. And most probably the time your genetic profile also you cannot change. What you can change? You can change the way you eat, whether you have any addiction like smoking or alcohol, what sort of water you are drinking, what sort of air you are inhaling. So, and of course there are certain virus which can cause cancer, so you get vaccinated in time, especially the hepatitis B virus, which is fortunately is now our universal immunization program, and human papilloma virus which can cause cervical cancer and oral cancer is also available. And more than that, living a healthy lifestyle. What is healthy lifestyle? That you eat well, eat fresh, drink a lot of water, do some sort of physical activity daily, and stay happy. So physical, mental and emotional well-being, and be aware of your body, what is normal for you, and in case you find something abnormal, go and see your doctor. Now we generally say there are 7 cardinal signs of cancers, which say if you have them, it may be cancer, and I would say may. Like you have a cough which is not getting better for more than 2 weeks. Now it can be just an infection, but it can be an early sign of lung cancer. You have an oral ulcer which is not getting healed. Now it can be just a dental trauma, but it can also be an early cancer. You have a lump which is getting bigger and is not going down, whether painful or painless, and there is no history of trauma. You have some sort of bleeding, especially for female, the bleeding from their genital tract, or bleeding from your breast, or any other ulcers which is not healing anywhere. You have a loss of weight, which is not, you are not trying to do that, so unexplicable loss of weight, low grade fever. So these are some of the symptoms which is going on. You should go and see a doctor. Now, in most of the cases, I say 90% cases, it turns out to be most probably some infection, some benign cause. But the 10%, it might be a matter between life and death.
It may be a matter between life and death. Sir, adding on to a question from the panel discussion, as you have said that tobacco has been a leading cause for cancer in men. So what?
Well, tobacco has been a leading preventable cause in cancer of men.
Yeah. So what role do you think taxation on tobacco can play over this? as India has signed a pact to under WHO that the taxation should be 75%, whereas in India it is 52% on cigarettes and other BD and non-smoking products. It is even lesser. So what the role will
I
be?
understand. See, the thing is that I am not a policy maker, but I am simply just by raising taxes, you cannot change people's habit. Now, if the person used to, maybe when it become too expensive, people will less smoke, but they might even change to other form, like from cigarette, they might change to BD. Huh? They might do to hand rolled cigarettes. So I think access to the tobacco product is also an important issue. The experience shows that people usually start smoking when they're in high school. So access to tobacco and tobacco related products to kids are very, very important. It has been seen if you're not starting smoking by age of 25, most probably you will never smoke in your life. Most probably, few of them are exception. Secondly, the oral tobacco, it has become very, very cheap with that available of pouch tobacco. And you must understand tobacco is a drug. Now, what is drug? When I was a student, say 2.5 decades earlier, we used to think that tobacco only has psychological dependence. But now we know nicotine has a physical dependence, that you can have actually withdrawal symptoms. And the actual effect of nicotine is very, very high. If you talk about khaini, which is basically tobacco mixed with slaked lime, people make a pellet and put it in their mouth, so that lime causes irritation of the oral mucosa, there is a vasodilatation, and the nicotine get absorbed directly. The amount of kick it gets is nothing sort of any other drugs like heroin or something. And it also, taken chronically, decrease your appetite. So laborers, they prefer to take it. Long distance bus drivers, they prefer to take it. So it is very easy for us to say don't take, but unless and until we make a conducive atmosphere to prevent the accessibility, only taxing tobacco, cigarette is one way, but people will always find another way. They will go to a cheaper options. So I think there is an overall holistic approach is needed to prevent the access. And as long as government is planning to make money out of it, I mean, of course they can, but I think the healthcare cost will ultimately outrun the revenue they get from tobacco.
So the economic burden will be more, and the holistic approach is more preferred. That is what he's trying to say, not just the taxation. Sir, last question. If you consider Indian healthcare, what are the problems, loopholes you see, especially with respect to cancer treatment in India, and how those loopholes can be rectified according to you?
Well, first of all, the positive things, the government has started now realizing that non-communicable disease like diabetes, hypertension and cancer are important thing, and there is a national cancer mission also. However, to effectively implement that, we need fund. So I believe the healthcare budget of the government needs to increase significantly. Right now it is somewhere, I don't know, I think it is 2.5 to 3% of the GDP. I think it should be at least 5 to 6% of the GDP, if not overnight, maybe in the next 5 years. Because again, I would like to reiterate, investing on healthcare, especially the primary healthcare and primary education, has a long-term positive impact, which has benefit beyond immediate visual effect. So, and there are primary healthcare, prevention of healthcare is something which the private entrepreneurship will not be interested, because it doesn't have an immediate return on investment. So I think the government, they are trying to put a mission, but on this mission they have to act on a mission mode. And the healthcare budget, the government health facility infrastructure, now that there are many medical colleges are coming overnight, the district hospital being converted to medical colleges, but they are woefully inadequate in their health infrastructure. So, but just converting them by name will not work. You have to give them educated and trained adequate manpower, which is unfortunately not there in every cases. So I think that our government need to see.
So increase in the allocation of budget, manpower increase, and capex investment. That is what our doctor is saying. Thank you so much, doctor, for talking to us.
Thank
It was great pleasure
Pleasure.
talking to you.